Hello, my name's Paula Morgan-Clough and I'm the lead professional midwifery advocate here in the maternity unit at Northampton Hospital. I just wanted to come on because we know it's really difficult times for mums and families expecting their babies. And we just wanted to come on just to give some reassurance to say we really do understand and we are working really hard to make sure when you come in that you feel safe and well cared for. So at the moment, when you come in to have your baby, your partner will be with you for the whole of the labour and they'll be able to stay with you for a good 2 to 4 hours after the labour while you remain in a single room. Many ladies at this time are choosing to actually go home straight from either the birth centre or labour ward, so they're actually not separated from their partner at all. And if you wanted to do that and everything was fine, that's absolutely a possibility for you to be able to do. When you come into the unit at the moment in labour, you are offered COVID testing for both yourself and your birth partner. If you're having an elective caesarean section, when you come in for your pre-op, your partner will come with you, which is the day before, and you will both be offered COVID testing. When you come in for your section, your partner will be asked to wait in the car, or if you don't live too far away, he can go home. And then you will be able to notify your partner about 10 to 15 minutes before you're due to go into theatre. Your partner will come back. They'll be with you all the way through your caesarean section. And when you go into our observation area, they'll be able to stay with you for around 1.5 hours to 2 hours before they have to go home. Once you're then transferred to the postnatal ward, you'll be able to have visiting between 2 and 6 every day for the duration of your stay. If you're coming in for an induction, again, you and your partner will be offered COVID testing, and your partner will be able to be with you for 4 hours per day whilst you're up on Balmoral at the early start of the induction. Once you move to labour ward, your partner will be with you for the entire time that you are in labour ward in a single room. We are continually looking at the guidance, and as most people are aware, the guidance did get updated and revised on the 8th of September. It's something that we are continually working with our infection prevention team and our estates department, because obviously every hospital has a different footprint, and we continually have to be mindful that the 2-metre social distancing rule has not changed since COVID began. Some of our rooms are bigger, some of our rooms are smaller, and that really makes a difference as to whether we can accommodate partners in for appointments. With regards to the ultrasound, which I know has caused a lot of anxiety, understandably, as most people know, the 12-week scan and the 20-week scan are done up in a different department to maternity. The rooms that they use for the obstetric ultrasound are very small. And when infection prevention went over to scope those rooms to see if we could indeed safely socially distance, there was actually no way that we could provide 2-metre social distancing in those rooms. So we're looking at other ways that we can allow partners in with some more provisions, and we're working with the Estates Department to do that. And we hopefully will have some positive and good news about that in the next few weeks. In terms of our maternity day unit and our triage facility, which is in Area L, from Monday the 5th of October, again in conjunction with infection prevention and our estates department, we are going to be able to offer partners to come in when ladies have appointments in those areas. We have made some provision that partners can wait in the waiting room, but there may not always be enough space, and we would maybe be asking you to wait in your car until your partner goes in the room to be seen. In terms of Area K, where our consultant antenatal clinic is, again, we are going to try our very best to facilitate that partners can come with you for those appointments. But again, we can't always 100% guarantee that. In terms of our community facility, which is predominantly now at the Saints Rugby Ground, we have had a risk assessment done by our infection prevention team, but unfortunately, with the amount of footfall that goes through there and the setup of the corridor, which is incredibly narrow, we are not going to be able to allow partners to attend for those appointments. So I know that's disappointing and we're really sorry, but as long as we're there at the moment, that is how it's going to be. To be honest, at the moment, things are changing all the time, and I think we're all aware of that because what we hear and what we see in the news. So we are reviewing our restrictions with regards to visiting and partners attending for appointments on a very regular basis. So although we're making some new changes, which is really positive for everybody, from Monday, obviously, if local intelligence changes around the COVID infection rates, it's not to say that we won't have to make changes in the future. We really want to reassure everybody that nobody at Northampton has birthed alone, and we really make every provision to care for our women and keep them as safe as possible. We also have to incorporate caring for our staff and also for a proportion of women that we have coming through our unit who have underlying health conditions, who need extra protection, and also our community from BAME, who also, as I think we all know, need to have extra protection. Our staff have adapted really well, as have our women and their families, to this very strange situation that we find ourselves in. None of us have ever been here before working in a situation like this, and we've all had to adapt very quickly to all the changes that have been happening. But we just want to reassure you that although sometimes antenatally, I know because of the phone calls and the ladies that I see, there is a lot of anxiety, the majority of women that are coming through and using our service and birthing their babies postnatally have very positive experience given the challenging times that we're working in. We're always available here as a senior team to be able to talk to you and answer any queries and allay any fears that you may have. So you're always welcome to get in touch, and we are always listening.